I first wanted to be a doctor in college in a neuroscience course. I just loved the combination of the physical aspect of the body with the psychological aspect of health. I love interacting with my patients. I love educating them on how to stay healthy, how to avoid being sick. The chance to alleviate suffering, to promote health, to restore health is an awesome privilege. That's why I come to work every day. So many of our diseases today are based on lifestyle and poor access to good nutrition and healthy exercise. I feel if I can educate my patients, empower them to make good decisions, we can work together to keep them healthy and off lots of medications. I enjoy interacting with patients of all ages. That's why I chose family medicine, is that I get to interact with infants and children and adolescents and adults. I get to treat multiple generations of the same family. It's really exciting to get to really know a patient and their entire family. That really helps me deliver better care, personalized to that patient, and it's a lot of fun too. Interacting with my patients, helping them feel better and stay healthy is the best part of my job. Lindale is a great community. I get to know my patients both in the office and out in the community, which is a great privilege. We have wonderful patients that are very motivated to engage in their health and to make good decisions, and it makes my job a little bit easier.